You've probably heard the term minimally invasive surgery, or MIS, thrown around as it pertains to spine surgery. But what does it really mean? My honest opinion is that minimally invasive surgery is part marketing gimmick and part surgical technique modification. Many patients come in my clinic requesting a minimally invasive surgical treatment option, despite the lack of research to support this clinical practice shift. One thing is certain: MIS surgery has modified the patient's perception as it pertains to spine surgery forever, for better or worse. I say this simply because when you add up the lengths of multiple incisions that are necessary sometimes to do the surgery in an MIS fashion, the same surgery can many times be accomplished through a smaller, traditional midline open incision. On top of that, the amount of radiation required to accomplish surgery in a minimally invasive fashion is oftentimes higher than traditional open surgery. If you ask ChatGPT to explain the difference between MIS and open surgery, the answer you receive is, well, think of traditional surgery like using a bulldozer to dig out a hole. Effective, but a bit heavy-handed. The ChatGPT example by no means provides you with a clear or accurate idea regarding the true meaning of minimally invasive surgery. Let's dive into the real meaning and hopefully teach you the true difference in the process. Many times, the difference between open surgery and minimally invasive surgery refers to the method by which the surgeon does the decompression of the spinal cord and or the nerve root. If the surgeon decompresses the spinal cord or the nerve roots in a traditional open fashion, that is more classically described as a direct decompression. If the surgeon, however, decompresses the spinal cord or the nerves in an indirect fashion, meaning that they never truly directly look at the nerve or the spinal cord and rely on what's called an indirect technique to decompress the nerve, that's how many surgeons are defining minimally invasive spine surgery. This is not always the case, but let's explore this concept a little bit more. So at its core, minimally invasive surgery is exactly what it sounds like. Surgery that's done with the least amount of soft tissue disruption possible. Instead of making one large incision, surgeons use smaller incisions and specialized instruments and even sometimes robotic assistance to help you do the surgery. The goal is less trauma to the body while also still addressing the underlying spine issue. In many cases, this technique decompresses the nerves indirectly, meaning the surgeon creates space around the nerve using a specialized approach without ever directly seeing it. The potential benefits of minimally invasive surgery include: 1. Smaller incisions, which can mean smaller scars. 2. Less blood loss during the operation. 3. Shorter hospital stays, and maybe even a faster initial recovery. So it sounds like a no-brainer, right? Well, hold on, not so fast. Before you think, sign me up, let's talk about whether minimally invasive surgery is actually the best choice for you. Many patients come into my clinic specifically asking for a minimally invasive surgical option, but the reality is not every patient is a good candidate for a minimally invasive case. So here's why. Some complex cases require open surgery. That's controversial, but let me tell you why. In certain situations, an open approach is actually more efficient. So for example, if we need to remove old hardware or instrumentation, or minimize surgical risk, or perform a corrective osteotomy, an open midline incision might actually make more sense. Radiation exposure is also usually higher with a minimally invasive technique. Many MIS techniques rely on fluoroscopy, which is real-time X-ray guidance, which can significantly increase the radiation exposure compared to traditional open surgery. Incision size isn't always smaller. When you add up the multiple small incisions used in minimally invasive surgery, they often total the same length as a single midline incision in open surgery. So while MIS sounds great in theory, it's not always the best option for every case. The truth is, there's no one-size-fits-all answer. Your individual condition, your anatomy, your surgical goals, these all determine whether minimally invasive surgery is a good fit. Here's what matters. Some conditions require open surgery for better access. Your surgeon will determine the best approach based on your diagnosis. Not all spine surgeons specialize in minimally invasive techniques. If you're considering it, go to someone who has extensive experience in both open and minimally invasive approaches. They'll know the difference. Certain medical conditions may limit the effectiveness of MIS procedures. Your doctor can help you decide what's safest for you. While minimally invasive surgery has many benefits, it's not perfect. Here are some key considerations. Increased radiation exposure. Many MIS procedures require frequent X-ray imaging, leading to significantly higher radiation doses than open surgery. Not every condition is a good fit. Some procedures can't be done safely using MIS techniques. Surgeon skill and experience matter. Minimally invasive surgery techniques require specialized training, so not every surgeon is qualified to perform them. Long-term outcomes? Well, in most cases, research shows that the long-term results of minimally invasive surgery and open surgery are similar, but it depends on the patient and the procedure. When I was a resident, there was a staff member and he did a lot of minimally invasive surgery, and I operated with him a ton for years, really. And I got to see the outcomes of minimally invasive surgery. All his patients had minimally invasive operations done, and so I got to see that. And then when I went to fellowship, things were different. The fellowship program that I went to was a more traditional open fellowship program. I chose that for that very reason. I had this great experience learning how to do minimally invasive surgery as a resident. And I wanted the other side of it, you know what I mean? I wanted to see open surgery and to see if there really was a big difference. Well, it turns out you can still do open surgery very well. You can still achieve very good outcomes with open surgery. And what I learned was evident from day one. So one of the cases that we did together was a traditional open decompression infusion for the lumbar spine at L5S1. The patient had a pars defect. We did a gill laminectomy. We harvested the bone. We did a transforaminal lumbar interbody fusion, and we did a bone grafting procedure, closed him up. Patient did very, very well. In fact, so well, I was certain, based on my experience as a resident, seeing nothing but MIS cases, I was certain that this patient was gonna do terribly. And it was actually the exact opposite. Like the very next day, the guy was up and walking, he was doing great, discharged hospital day number 2, and I was blown away. I was like, wow, so this patient did just as well as what I've seen for the last 2 years. Minimally invasive spine surgery can be an amazing option, but it's not for everyone. The key takeaway is this: minimally invasive surgery is a tool. It's not a cure-all. The best surgery is the one that fits your unique case. If you're considering spine surgery, have an open conversation with your doctor. Ask questions and ask if minimally invasive surgery makes sense for you, or if a traditional open approach might actually be a better choice. If you found this helpful, I share a lot more spine health tips on this channel. Hit like, subscribe, and drop a comment below if you have any questions. I'd love to help you make the best decision for your health.